In ice hockey, different players have different roles. You may have a center who's a great playmaker, but you also need grinders who can go into the corner, who can dig the puck out, and you need puck-moving defensemen who can transition your team out of the defensive zone to the offensive zone. And from that point of view, it's very similar to what we do. We don't need 5 people who can do clinical trials and have no basic scientists or translational researchers. We actually need people fulfilling all of those roles to beat cancer.
The dream team is not about any individual player. It's about all the players coming together.
We all have to work together, and we have to be open to new ideas coming from the bench, coming from the basic science laboratories. We need to be open to ideas that don't come from laboratories, but come from looking at hundreds of thousands of patients who have this problem, and then we see something in common that we can intervene.
Yes, the people are really smart. Yes, the people put patient care first, but I think probably the most important thing is that it is a synergistic relationship with the personalities of all the different people who work together, and it builds a culture of collaboration, and that is what helps move things forward.
It gets back to that theme of team that is so important to giving you the best chance at the best case scenario.
You know, 30 years ago when I started in this business, it was not good.
And between 1985 and 2011, we made no progress.
We had recently opened a clinical trial that was evaluating a new chemotherapy regimen called FOLFIRINOX that had been shown to improve survival and response rate in patients in whom the cancer had already spread.
And we had an idea to start treating people who had locally advanced disease with that same chemotherapy regimen.
Locally advanced pancreas cancer just means that they have blood vessels involved that you have to be alive. And so you can't just take them out.
We wanted to see if we could shrink it down and make it to a point where someone like Carlos or Christina, one of these great surgeons that we have at Mass General, we wanted to see if we could shrink it to a point where they could cut it out.
This is something that was unheard of. People would say, are you crazy?
And we started doing these operations, which are operations that nobody had really done because they're so extensive and they're really complex and really involved.
And the first patient she did it on, the CAT scan looked completely unresectable still after the FOLFIRINOX. And Christina said, screw it, I'm going in anyway.
And so those patients normally, in a normal institution, probably would have never gone to the OR. But our surgeons here took the leap and said, let's just go see what we find. Even the CT scan said there was a mass there, it was a dead mass.
Everything around the blood vessel was just scar tissue. So Bob comes walking into our office right around that time.
My name's Bob Edel. I'm 59 years old. I'm married to my lovely wife, Marion, for the last 35 years. We have 2 great kids, and we moved to Boston about 10 years ago so that I could take a job with Harvard Management Company, which is the organization that manages the endowment for the university. So up until July of 2013, I was in relatively good health. I certainly wasn't prepared for a diagnosis of cancer, let alone a diagnosis of pancreatic cancer. The best way to describe it is you're walking along and minding your own business, and all of a sudden a meteorite falls out of nowhere and hits you on the head.
We set up a date right away and met the patient together with Ted Hong, as is our custom, to look at these patients with pancreatic cancer. And we were looking intently at his CAT scan, and it did not look good.
So we presented that clinical trial option to Bob, and he agreed to be enrolled into it and was treated on that study.
And Bob underwent treatment, not just with chemotherapy, but then with radiotherapy, and we took him to the operating room. And to our great surprise, he had a wonderful response.
I'm not quite sure how Dr. Fernandez de Castillo is able to stand on his feet for 6 or 8 hours at a time, but I had a very responsive surgery, and we thought I was cured.
Dr. Fernandez, Carlos, did his pancreas operation, but then he came back with a metastasis to the liver and the lung.
Now Christina's involved, because Christina's not only a pancreas surgeon, she's a liver surgeon, and we get the lung surgeon involved, Cam Wright. And we said, hey, can we cut both of this out at the same time? And that's something we do in colon cancer, but we never do in pancreas cancer. Like, it's just not done. But we're in this mindset now, like, we're the Mass General, we're not gonna stop here. And it's a much more dangerous operation when you do that. But she said, I'm gonna go after this because this is the best chance for the best case scenario for these patients. They cut out the lung met and the liver met, and that was 2.5 years ago. And so Bob was a part of this thing in pancreas cancer that started at the Mass General, in part because you had this great young surgeon pushing the oncologist to give the best chemotherapy they could give and pushing the radiation oncologist to give the best radiation they can give, and then taking them back to the operating room, even though the radiologists are saying, I don't think you can get that out. And finding that, wait, our paradigm was all wrong.
Given that we started this program in 2011, we are seeing long-term survivors at a much greater rate than we've ever seen before.
So we're not talking about the tail of the curve anymore. We're talking about shifting the whole curve to the right.
There is no question. Patients are living longer. Patients are being cured. Patients are reaching that 5-year landmark, which was so rare and so precious.
That's what we would want for our mom, our dad, our brothers, or sisters, and that is what this trial has done. And that is what I, as a scientist and a clinician, I'm so excited for.
If you would ask me if I'll ever be in a position to be sitting there talking to somebody about life with somebody with locally advanced pancreatic cancer 5 years after the diagnosis, I would have said, there's no way, it's not happening. And I'm an oncologist, like, we're the most hopeful people on the planet. And it's happening. In fact, Bob took us out to dinner for a celebration of life. And I have the menu on the wall with Bob signing it.
The science is there. It's just that we need to be able to do the trial on the patients, and that requires support.
It's these young people in the lab and young people in the clinic, and they're sitting there talking, and next thing you know, they're like, hey, Dave, I got an idea, and will you support it? And thankfully, we have philanthropy that supports all of these early ideas that wouldn't have happened if we didn't have the money to say, let's go ahead and try and do this and put together a clinical trial. And that's actually how it happened.
Every time there's a negative setback, I've been fortunate in that I've had great medical care. And I've been fortunate in life. I've accomplished the things I wanted to accomplish. I have a family that I love and loves me. And I've been able to give back as much as I've taken away. And so when you have that as a backdrop, you've got a wind in your sail. And I try to not take everything for granted anymore because it was almost taken away from me. I'm Bob Edel, and I'm a 5-year survivor of pancreatic cancer.